If you are into this practice or curious to start, but you're wondering if there's a connection between anal sex and colorectal cancer, let's see what the evidence shows. It is in everybody's best interest to practice sex in the healthiest way possible, and I am here to help you have fun and stay safe while enjoying your sexuality. So join me as we separate the myth from the truth about anal pleasure and the risks to your health. Hi, I am Dr. Tanji, the Sex Doctor, board certified clinical sexologist, and your most trusted, honest, and fun sexpert on this platform. If you are new to my channel, welcome. I am so happy that you're here. Join me in this sex positive global community in which we discuss all things sexual health without any judgment or shame. And do me a great favor and subscribe. Subscribe to show that you like my content so we can continue to grow this forum. You may also become a part of the Sex Curious or Sex Intelligent Club for exclusive content not available here. What are you waiting for? Subscribe. Thanks. Now back to our anal sex matters. Does anal sex cause colorectal cancer? If you've been the receiver of anal intercourse before, or if you are considering it, should you be concerned about the risk of developing colorectal cancer? Let's find out. The good news is that there is no direct evidence to suggest that anal sex itself causes colorectal cancer. However, there are some factors related to sexual behaviors that may increase the risk of certain conditions, and these should be considered in the broader context of sexual health. Specifically, the human papillomavirus, or HPV, has a connection to anal cancer. Anal sex can increase the risk of HPV or an HPV infection, especially if there is no protection like condoms. HPV is a known cause of anal cancer, particularly in individuals who engage in receptive anal intercourse. HPV is a very, very common virus that can infect the skin and mucous membranes, and while most infections clear up on their own, persistent infections with high-risk strains of HPV, such as HPV 16 and 18, can lead to the development of anal cancer over time. The risk of developing anal cancer is higher in individuals with compromised immune systems, such as those with HIV or immunosuppressive conditions. Other risk factors are smoking. Smoking is a well-substantiated risk factor for colorectal and anal cancers. Smokers who also engage in anal sex may face an increased risk. Age. The risk of anal cancer increases with age, especially after 50. Multiple sexual partners. Having multiple sexual partners can increase the likelihood of exposure to HPV and other sexually transmitted infections, which may elevate your risk of anal cancer. What's the difference between colorectal cancer and anal cancer? It is important to distinguish between colorectal cancer, which affects the colon and the rectum, and anal cancer, which affects the anus and anal canal. The primary risk factors for colorectal cancer are diet, family history, inflammatory bowel diseases, and certain genetic conditions. Anal cancer, on the other hand, is more closely linked to HPV and sexual behaviors. So how do you prevent anal cancer? Well, very, very easily. Vaccination against HPV can reduce the risk of HPV-related anal cancer. The vaccine is recommended for both males and females, especially before they become sexually active. Regular screening for anal cancer, such as anal pap tests, is recommended for individuals with higher risks, including those with HIV or a history of receptive anal intercourse. And last but not least, wearing condoms, especially if you are going to engage in anal sex. While anal sex itself does not directly cause colorectal cancer, it can increase the risk of anal cancer if associated with HPV infection and other risk factors. Safe sexual practices, including the use of condoms, vaccination against HPV, and regular screenings, can help reduce these risks. Colorectal cancer has different risk factors, and sexual activity is not a direct cause of this type of cancer. If you have concerns about sexual health, cancer prevention, or risk factors, consulting with a healthcare provider who specializes in colorectal health or sexual medicine is probably in order. As always, I wish you great sex. See you next time.